Greetings from the Sylvester Comprehensive Cancer Center at the University of Miami, Miller School of Medicine. My name is Dr. Alberto Caban-Martinez, and I'm an Associate Professor of Public Health Sciences and the Deputy Director of the Sylvester Firefighter Cancer Initiative.
Hi, and I'm Natasha Schaefer Solle, a Research Assistant Professor of Medicine and also the Deputy Director of the Sylvester Firefighter Cancer Initiative.
And today we're excited to talk about total worker health. It's actually a strategy for firefighter cancer prevention in the fire service.
So today we're going to cover the background and rationale of total worker health. We're also going to have an interactive total worker health session specific to firefighters, and then talk about opportunities for how total worker health can be implemented among firefighters in the state of Florida. At the end, we'll then have a chance for a Q&A.
I want to thank my colleague, Dr. Natasha Schaefer Solle, as over in the next few minutes, her and I will be presenting to you on this concept of total worker health. But before we begin, let me get a sense of where you're at with the size of the firefighter workforce. Begin by answering the question on the screen. What is the size of the US population? So if you had to give a guess, how many Americans actually live in the United States, both documented and undocumented? Take a minute to reflect on this question. So if you said 350 million Americans, you are correct. The latest estimates in 2021 are about 348 million Americans live in the United States. So about those 348 million Americans, how many do you think make up the firefighter workforce? Take a minute to reflect on this question at the top of your screen. What is the size of the US firefighter workforce? So if you said 1.1 million, you are correct. So in 2017, the National Fire Protection Association estimated that about 1.1 million career and volunteer firefighters are certified in the United States. So that's about 35% of the workforce that makes up the career professional firefighters. That's around 373,600 career firefighters, and it has been slowly increasing. Compare that to the other 75% of the workforce or 65% of the workforce that constitute about 682,000 volunteer firefighters. So the actual workforce is largely made up of volunteer firefighters. So how many of those are females? So the NFPA estimates that about 7% of the firefighter workforce is made of females and increasing every year. 51% of those firefighters tend to be between the ages of 30 and 49. And we estimate that there's about almost 30,000 fire departments across the United States. So let's take a zoom in here into the state of Florida. In 2017, we estimate that there's about 69,278 both career and volunteer firefighters. About 45,000 are career and around 23,000 are volunteer firefighters. In total, we also estimate that there's about 532 fire service providers across the entire state of Florida, all the way from the Panhandle down to the Florida Keys. So what approach do fire departments use to keep firefighters safe and healthy at work? So stop for a minute and think, what are some of the strategies that you can use to implement health and safety in the fire department? So let me show you, in the center is a old school occupational health and safety program as implemented in a fire department. Usually there are several components to this OSH program. You can think about training and supervision. So how are new firefighters trained and maintain their training throughout their tenure? We can talk about the preparation of work procedures, of how you run the actual fire department. There may be committees that help with establishment of operations. You may have a group of individuals that are focused on controlling of hazards. There may be an actual hazard identification program. You might have investigations that follow up on accidents and injuries that happen to the workers in the fire department. You also may maintain records and statistics about the total number of injuries. Taken together, all of this makes up the occupational safety and health program of a fire department. So let me take you back in time about how occupational health and safety has been transformed in the landscape starting since the 1800s. Traditionally, OSH programs have been very monolithic or monodisciplinary. Usually there's one person that's working on health and safety in the workplace. It really wasn't until the 1970s here in the United States that occupational health and safety was codified through the OSH, Occupational Health and Safety Act, that created OSHA and many other federal agencies that keep us safe and healthy at work today in the workplace. When you fast forward to 2021, the occupational health and safety has been really transformed from a passive OSH program to a forward progressive workplace health and safety opportunity. So if you look all the way to the right of your screen, you'll notice here there is a need for interdisciplinary sciences in occupational health and safety as we focus on well-being at workplace, health promotion, and well-being and quality of life. So no more it's just keeping you safe at work, but how can we improve the workers' health while they're at work? So let's take a look at the evolution of workplace health promotion programs. So on the left, you'll notice that there are sort of three pillars we're going to take a look at: the primary focus, the common characteristics, and the performance outcomes. We'll look at three pillars: the traditional way of doing things, an intermediate scene of workplace health promotion, and then what we consider innovative and new health place work promotion programs. So we'll begin with the traditional programs. Traditionally, they're primarily focused on morale. How do we keep the workforce engaged and happy in the topic? Some of the common characteristics is that some of the activities can be fun, circling around risk reduction. There's not a high risk focus. Every of the activities in the traditional program are voluntary. And the performance outcomes usually are low performance. You don't see a lot of folks engaged in traditional occupational health and safety programs. The intermediate step is primary focus is on activity oriented. How do we get folks engaged in specific tasks around health and wellness programs? The common characteristics we see is it's mostly a health focus. Like, what are the health aspects that the workforce and the worker wants to work on? There is some high risk reduction, little high risk access, and again, everything is voluntary here, and we see a moderate performance across different workforce. And then the ideal and modern way of doing workplace health promotion programs is through integration of occupational safety and health with the wellness programs. And this tends to be a results-oriented type of program. We want to get folks motivated and engaged in the workplace health promotion activities that are delivered at the site. So what are some of the common characteristics here? We can see added productivity. There's a strong emphasis on the reduction of harms, and there's some required activities, not all are voluntary, and there's a strong personal and major incentives in being involved in the program. As a result, the performance outcomes tend to be very high performance. So what does the future of work look like? This is a very interesting cover from Time magazine showing us how society has evolved through work. The Total Worker Health Framework will encourage us to look at the aspects of work, both from hazards, the employment arrangement, and the actual workforce itself. So what are some of the hazards that we can expect from the work environment? We will consider the traditional hazards that we see at work, but we also expect to have new and emerging differences. For example, in the last year, we have new viral infections as COVID-19 that has critically transformed the landscape of workers being engaged in their work environment. So we expect that new and different hazards will always be emerging in the future within the work environment. We also consider the context of employment. For example, in the firefighter workforce, will we have a shortage of workers? Will we have less workers available, less individuals interested in volunteering as a firefighter, and more entering the career aspect? Will there be more global competition from other workers outside of the United States wanting to enter and fulfill a role, or exporting certain jobs that are done here in the United States and doing them outside? Also, the arrangement of work. Will it be flexible or will it be precarious? Will you have a little bit of autonomy deciding when you work and how you work, or will things be focused very rigidly? There's also the context of the workforce. So we want to think about aging workers. It's true today that many Americans are delaying retirement. And through the delay of retirement, we would expect to have much more older workers remaining engaged and involved in the workplace. And while many are sometimes scared of having older workers in the workplace, there are many pros and advantages to having some silver-haired workers being engaged in the workforce. We could consider all the other health-related issues. As one age, we get chronic diseases. And so maybe we will see more workers with chronic diseases still being involved. Unfortunately, we're also concerned a lot with obesity. So many lifestyles have become more sedentary, including the automation of certain work aspects, which lead to overweight and obesity classification. So how can we use the Total Worker Health Framework to understand these concerns that are happening within the workforce? And lastly, we think about multi-generational. Imagine working with a team of workers of different ages. How can we get them to work together in a synergistic fashion? So join me in the next couple of minutes as we explore these very important topics. I'm going to begin by giving you an overview of the Total Worker Health approach. So thinking about workplace safety and health and well-being, where you work, the context of your work, has been shown to contribute to both the safety, the health, and the well-being. In fact, take a look at this pie chart in front of us. If you look at the distribution of work and home, work being represented by the orange, you can see how many of these factors actually intrinsically impact our life. And then when we look at the home environment, we see the synergy between the two. So for example, what is the diet and nutritional value of things that you consume at work? And what is the diet and nutritional aspects of what you consume in the work environment? Similarly, are you exposed to smoke, say from cigarettes at home and in the work environment? What is the noise levels like both at home and at work? These factors, both on and off the work site, can significantly impact overall worker health and well-being. And the Total Worker Health Framework allows us to take a look at those factors together. So what is this Total Worker Health Framework we've been alluding to? So it is officially defined as the policies, the programs, and the practices that integrate protection from work-related safety and the health hazards with promotion of injury and illness prevention efforts, with the overall goal to advance worker well-being. So taken together, the Total Worker Health Framework allows us to study a particular topic through the policies, programs, and practices at the place of work. So I wanted to spend a few minutes actually defining policies, programs, and practices to make sure you have a clear understanding of how we delineate all three. So in principle, a policy are any rules and guidelines that are formulated or adopted by an organization, such as a fire department, in order to reach its long-term goal. So what's an example for us in the fire service? So an example for us could be the National Fire Protection Association and how OSHA require fire departments to have an organizational statement on how to handle structural fires. So this is a policy, rule, or guideline on how to handle safety. Now, what's a program? So a program is a plan of action aimed at accomplishing a clear objective. It'll have details on what work is to be done, by whom, when, and what means or resources will be used. So what's an example of a program in your fire department? I'll ask you to stop for a second and reflect on any of the programs that you have come across in your fire department. One example, as you see on the slide, is a hood swab program. So if you wanted to reduce carcinogenic contamination on the fire scene, your fire department could implement a hood swab program, where upon return from a fire incident response, the hood that was contaminated with carcinogens could be swapped out for a new clean hood while your old hood gets washed. And that would be a program that would be delineated within the fire department. Okay, third and not least are our practices. So what do we consider a practice in an organization? So a practice is the actual application or use of an idea, a belief, or method, as opposed to theories that are relating to it. So what could be a practice for us in a fire department? So think about a common practice being for duty and work boots to be left in the bay and not brought into the station. So it could be a practice of the fire department when you come back from a fire incident response to place your boots in an area that doesn't support traction of the carcinogen in and around the fire station. This may not necessarily be a policy and may not be a program, but by practice, this is just something that we do at our fire department. So keep these three terms in mind, because as we explore in the next few minutes total worker health, we're going to be using these three aspects, policies, programs, and practices, to figure out how we can reduce carcinogenic spread within the fire department. The Total Worker Health Framework looks at health and safety from two lenses. The first lens is from the worker perspective. How do we protect the health and safety of workers and carcinogenic exposures at the firefighter level? The second application of total worker health is through the fire station level. What are aspects of organization that can be modified in order to protect our firefighters from carcinogens? So I always like to say that when you are studying total worker health, never always blame the worker for issues that happen. Always consider aspects of the work environment or at the organizational level that we can modify to protect their health and their safety. So where did this total worker health framework come from? So it actually was the initiative of the federal agency called NIOSH, or the National Institute for Occupational Safety and Health. NIOSH started the Total Worker Health Framework as the Work-Life Program. It was actually designed as a health and safety program for the employees at the Center for Disease Control. In June 2011, NIOSH launched officially the NIOSH Total Worker Health Program, leveraging learned lessons from the multiple years of the NIOSH Work-Life Program. Today, the Total Worker Health Program recognizes the new technologies, the working conditions, and emerging forms of employment that potentially present new risks to workers' safety, health, and well-being. So I would be remiss without talking about occupational health and safety by reminding you about the 1970 OSHA Act. In 1970, Congress passed the OSHA Act. That act created 4 entities. The first is the actual agency itself, OSHA, called Occupational Safety Health Administration. They are the regulatory and legal arm of occupational health and safety. The act also created NIOSH, the National Institute for Occupational Safety and Health. NIOSH is a federal agency in the Center for Disease Control who conducts the research and informs the practice of occupational safety and health. The act created 2 other entities called the Occupational Safety and Health Review Commission, as well as enacted certain legislations indicating the minimum standards for keeping an employee safe while they're in the work environment. So OSHA is the agency that's responsible for promulgation of health and safety standards, and they're authorized to inspect workplaces and issue citations and civil penalties to any employers who are not in compliance with federal or state regulations. So where are these agencies located? In the president's cabinet, there are various executive branch agencies, and there are 2 that are going to be of interest to you for total worker health. One is the Department of Labor, who is the home to Occupational Safety and Health Administration. And the second is the Department of Health and Human Services, who's home to the Center for Disease Control and NIOSH, the National Institute for Occupational Safety and Health. So keep in mind, OSHA is the regulatory and the enforcement arm, and NIOSH is the information science and research arm of the federal government, home to the NIOSH Total Worker Health Framework. So remember that total worker health is the integration, right, of policies, programs, and practices that look at both the occupational safety and health perspective as well as workplace health promotion. Okay, so let's take a few minutes to look at this special video looking at an extrication incident event. Please pay close attention to the firefighters on scene and to the communication and support received by the incident command staff through this individual incident.
Dispatch to fire and police units attending the MBA on Burnside Drive. Switch over to Mutual Aid 7. EHS is on the scene and has command.
3 engine arrival, Burnside Drive.
Medic 257, 2 vehicle MVC with patients and traps. Assuming medical pan.
Command from 3 engine. What are your requests?
Engine 3 from command. We have 2 patients requiring extrication. Can you maintain a fend-off position and begin extrication, please?
We copy fend-off position and vehicle extrication.
14 engine to command. Arrival.
What are your wishes?
14 engine, can you set up a fending position and assist 3 engine with extrication, please?
14 engine 10-4, assuming second fend-off position and helping command with extrication.
East 10 dispatch, I'm on scene. East 10 to command, what do you guys need?
East 10 to command, we have patients we're currently treating and extricating. Can you take over command for me?
Copy, East 10's assuming command. Fire, can you guys stay in fend off for us so we get these vehicles hooked, please?
Copy that, command. We will stay in fend-off till vehicles are removed.
Thank you.
Medic 257 to command. We have all patients on board and we're departing scene.
East 10 to fire. Thank you guys very much. You guys can clear. Appreciate your help.
3 engine, we copy command. Services are no longer required. We return to the quarters and back to Ops 1.
In the absence of criminal acts, the following will take place. First unit on scene from any response agency is in command. All subsequent arriving units will seek direction from command. Command will be transferred to the most appropriate agency when they arrive on scene. All agencies will report to command prior to clearing the scene and report their tasks are complete. A mutual aid talk group will be requested and assigned when the situation dictates.
Dispatch, 3 engine arrival.
Copy, 3 engine arrival.
Command from 3 engine, what are your wishes?
10 Echo to fire. We've got a significant amount of smoke coming from 2 vehicles involved here. I'd like you to take over command.
3 engine copies. 3 engine is now Burnside Drive command. 10 Echo from command.
Go for 10 Echo.
10 Echo, could I get you to secure Burnside Drive from right to Acrely Boulevard, please?
10 Echo to fire. We have southbound on Burnside Drive shut down between Acrely Boulevard and Wright Avenue.
Copy that. We have Burnside Drive secured.
Medic 257 to command. We have no unwaiting assessments. What are your wishes?
Burnside command to EHS.
Go ahead, command.
You guys can return.
Medic 257 clear.
10 Echo from command.
10 Echo, go ahead.
We've knocked down the fire. Situation's under control. The street's been secured. We're going to hand the motor vehicle accident back to HRP.
10 Echo, copy that fire. 10 Echo dispatch, I'll be assuming command. Could you have 2 tow trucks make their way here, please? Owner's request. East 23, I'd like you to take over the standoff position from fire, please.
Command from 3 engine.
Go ahead, 3.
Do you need anything else from us?
No, I think we're good. Thanks for your help. Guys, you can clear.
No problem. Dispatch, you can show 3 engines return to quarters, and we're moving back to Op 1.
10 Echo to all units remaining on the accident call. All vehicles have been removed from the roadway. I'd like you to reopen southbound traffic on Burnside Drive. Once you've done that, you can clear. Dispatch, command is now terminated.
The incident commander, or IC, may transfer command temporarily to a more appropriate agency until a certain dynamic portion of the situation stabilizes, i.e. fire, mass casualties, etc. The IC will transfer command to the final or most appropriate agency after they have completed their primary function and the incident is still ongoing, i.e. fire is out, casualties transported. Agencies will form a team on scene and follow a verbal incident action plan. Agencies deemed not required by command will be asked to clear the scene.
East 10 to dispatch. Please show me on scene. I'll be taking command.
Hey. Yeah, there's poisonous gases in that van.
Anybody left inside?
No, it's just me here.
Okay, thank you. Command to dispatch. Speaking to the driver here. No one's left inside of the vehicle. There is poisonous gas. Could you please dispatch fire with a hazmat team? I'm going to need a mutual aid channel, and please let fire know we do have smoke and fire coming from that vehicle. Thank you. Command to dispatch. I'm going to need Burnside Drive shut down, please, at Wright and Acrely. Get those units to advise what the smoke status is there. I'm going to need EHS to stage some distance back, and I'm going to need to speak to fire at the rear of my vehicle as soon as they get here, please.
What's going on, Steve?
We got a motor vehicle accident here. No one's left in the vehicles. The driver has informed me there's poisonous gas.
Doesn't know what type?
Doesn't know what type, no.
All right, let's see what's going on. 1076, phosgene gas. Do we have an amount?
No.
Okay, we'll have to go with a large amount. We're looking at 11-kilometer evacuation zone.
So we got a pretty, okay.
Yeah, it's a bad one.
Give me a second.
Yep.
Command to dispatch, we have a significant incident here. We're gonna have to evacuate, and it could be as much as 11 kilometers out. We're gonna have to activate the incident management team, and I'm gonna need a command bus. Have the fire and the police units report to the bus, please, so we can task them.
Copy that, command. The command bus is on its way, and the members of the incident management team have been notified.
All right, so right now I met with safety. We start an 11-kilometer evacuation with several police task forces going out to empty the areas. Right now, our liaison officers liaising with our Red Cross Salvation Army to provide shelters for all the individuals that are going to be displaced, and it looks like it could be for several days. And logistics, we've satisfied most of the needs of the incident, and we're looking to set up a medical triage for all the responders. Our IO will be able to give a press briefing very shortly.
This will be the first of several media briefings we'll be giving over the next 48 to 72 hours. This is an integrated response to what we're dealing with this afternoon. On site here with our incident management team, we have representatives from police, fire, EHS, Red Cross, Halifax Water, Halifax Transit. This is a truly integrated response, and we're looking forward to giving you regular updates and to let people know what's being done to ensure safety of all residents in Halifax.
Okay, guys, it's time to go inside and work on the IAP for the next operational period.
The incident commander may form an ad hoc unified command with a partner agency early in an event to develop an incident action plan and to identify necessary strategies to move forward. An incident management team will be requested when it is evident that the situation will overwhelm the incident commander's span of control. A command post will be established and occupied. An incident management team will be comprised of partner and cooperating agencies filling position-specific roles identified by wearing an appropriate vest.
So what did you learn in this video? Hopefully you saw how the incident command officer had some difficulties in discussing with the other respondents how to handle this particular scene. Sometimes there can be conflicts between different workers on scene, for example, police and first responders. The Total Worker Health Framework allows us to leverage some of the individual aspects at the worker level and the organizational level to create the support for a successful extrication response. So when you think about traditional organization of a fire department, you may have sort of these disparate areas of organization. So a fire department might have an employee assistance program. It might have a specific group health insurance project. It might have a compensations program. There could be an occupational health and safety program. There definitely is one. A health promotion program, and as well as a presenteeism, absenteeism program. But unfortunately, in many landscapes today, these fire departments work very different with these individual aspects of the fire department. And so through a total worker health framework, we can organize them and bring them closer together. So the goal is that we take these silos of these individual programs and integrate them from a traditional health and safety aspect and traditional health promotion into an integrated approach. So that taken together, we can work using this framework to improve overall worker health, safety, and well-being. These are some of the issues that directly impact worker well-being and safety. You start off at the top left, looking at control and hazards of exposures. You also look at the organization of work. How does the shift work? How does the aspects of exposures impact worker health and safety? We look at aspects of the built environment. We look at the leadership structure at the station level, at the fire department level. We look at compensation and benefits. We look at the support that a fire department receives from their local community. How does the demographics of the workforce impact health? The policy issues, from workmen's compensation to vaccination, to even new employment patterns of how we hire new rookie firefighters into the fire department. All of these aspects taken together inform the total worker health approach. Let me give you 3 concrete examples to reflect on. So remember, our game plan is that we want to integrate occupational health and safety with workplace health promotion. So let's begin with looking at cigarettes and respiratory protection. So we know that in the fire service, there are actual users of cigars and cigarettes. And we'd like to encourage a decreasing or cessation of smoking in the fire service, as we know it is intrinsically connected to carcinogens and cancer development. But what if we could link education about smoking cessation to respiratory protection? How can we use PPE to limit our exposures to harmful carcinogens from fire incident response, as well as to secondhand exposures from being around people who engage in cigars or cigarettes? So one example is the provision of mandating respiratory personal protection that simultaneously and comprehensively addresses and provides support for tobacco cessation in a respectful and thoughtful way. Example number 2. So let's talk about hearing conservation. Being in the fire department can lead you to be exposed to very loud and sharp noises. So a hearing conservation program that provides, let's say, motor enclosure protection from machinery that's very loud and emits a lot of loud sounds with barrier types of materials that is also linked simultaneously to strategies to limit others' risks to hearing. Our goal is to try to protect your hearing so that when you retire, you have clear and good hearing. And last and not least, example number 3. So let's talk about musculoskeletal disorders, an issue intrinsic to the firefighter workforce. So in order to prevent musculoskeletal disorders, that is injuries of the bones, muscles, and ligaments, what about us reorganizing the work environment and redesigning it to limit our exposure to ergonomic hazards? That is, hazards that increase our workload, our physical load, and can potentially impact our joints and our muscles. So we can provide ergonomic consultations that perhaps is integrated with information on arthritis, so that we can stop from having arthritic development and crepitance, as you hear cricking in your knees and in your joints. So now that we've had an introduction and a broad overview to the Total Worker Health Framework, let's do a class activity. Dr. Solle?
Great. So work together with your classmates and first describe current policies, programs, and practices in the fire department that address worker health protection. So remember, these are the organization and worker level protections. The next thing you're going to do is talk about your current policies, programs, and practices in your fire department that address worker health promotion, again, at the organization and worker level. And the last thing you guys will do as a group is, what are some strategies to integrate both the health protection and health promotion in your fire department? So we'll give you a couple minutes to work together, and then we'll come back. Now that you guys have completed that activity, now we're going to talk about some of the research that has been done here in the state of Florida. So when looking at organizational level factors that influence cancer screening activities within the fire service, we were able to survey leaders in the fire service in Florida to see what things really made an impact on organizational level factors that influence the screening behaviors within the fire service. So what we saw was that there needed to be a OSHA program present, so an occupational safety and health program present within the department. Also, that the program needs to be updated on a regular yearly basis. And lastly, that there needs to be a written occupational safety and health program policy statement. So these 3 things are really key and really important. And it's important to note that it's very simple that any department can do this. So a lot of times when we talk about total worker health and making organizational level changes, many leaders think it may be an issue due to the size or the budget, but it really showed that the 3 main areas that were needed in order to make changes related to cancer screening was having a program present, how to, to make sure that program is updated regularly, and also to make sure that there's a written policy done, which anyone can do. So now we're going to talk about the Florida Firefighter Chart Book. So what this is we were able to go through the records and be able to characterize and compare the health status of Florida firefighters to white-collar, blue-collar, farming, and service occupations in the state of Florida. We then estimated the prevalence of cancer-related health behaviors such as tobacco use, alcohol use, BMI, and exercise in Florida firefighters and compare those to other broad occupational groups. So then the last thing is we are going to provide information regarding healthcare coverage and utilization of firefighters and other health access-related incidents. So firefighters were pulled from the service occupation group here. The occupations are classified in 40 different groups. So they're either white collar, service, farm, or blue collar. Our firefighters are listed under the service group and under number 24 right here as personal service occupations. And so going through the chart book, you'll be able to see that we will be comparing the firefighters to these other worker groups in the white collar, blue collar, and farm workers. So in total, we pooled, there was over 33,000 workers, with white collar being the highest, blue collar at about 6,000, service 6,400, farm 524, and the firefighters making up 131 of the workforce in Florida from 2015 to 2017. And so to break it down as far as the firefighters in this sample, we had 91% male. The average age was between 40 to 59 years old, with 58% being white, 29% other race, and 14% being black. For education, we had 81% that reported some college or higher, and 80% of the sample reported being married. So looking at the prevalence of health conditions among the Florida firefighters, we had, you can see those over the age of 60, with 48% reporting cardiovascular disease, 67% other cancers, 7% skin cancers, when it's broken down by age. If you're looking at the younger age groups from 18 to 39, we saw a higher incidence of skin cancer and depression. And then if we're looking at the Florida firefighters grouped by their marital status, again, with those who are divorced, we see that 35% reported skin cancer, 7% cardiovascular disease, and 5% depression. Some other health conditions that we saw, and this is broken down, we can see by gender, education, and race. So with our female firefighters that were part of the sample, we saw 53% reported having past skin cancer, 53% of depression, and 3% of other types of cancer. Those with some college or more, 9% reported skin cancer, 6% depression, and 3% other cancers. And so now we're going to look at the prevalence of health conditions among firefighters and compare them to the other occupational groups. So you can see among this on the top line, you have all workers, where you see a 2.1% of cardiovascular disease, 3.7 of COPD, 5.5 in skin cancer, and 4.1% in other cancer, and 1.8% in kidney disease. And so then we look at our firefighters, where we see a vast majority of them having skin cancer. So 7.6%, 2.9% of other cancers. So much higher than our larger group of all workers. And then when you look at other services, you can also see that we had a much higher incidence of skin cancer and a little bit lower for other cancers. And comparing those again with the blue collar and the white collar, we do see a higher incidence in our firefighters with the skin cancer. Now we look at the prevalence of health conditions among firefighters compared to other occupational groups, and looking at these specific health conditions of asthma, depression, arthritis, and diabetes. So again, you'll see on the first line, all workers with 10.9% of asthma, 11.6% of depression, 14.6% of arthritis, and 7.5% of diabetes. So our firefighters are a much healthier group when it comes to these other conditions compared to all workers, to service, blue collar, and white collar. We see them at a lower incidence for all four of these conditions. And now we're going to look at the prevalence of the behavioral risk factors among firefighters comparing to other occupational groups. And so the behaviors we're looking at is alcohol and physical activity. So we do see that our firefighters are more active compared to all workers, as well as the farmers, service, blue collar, and white collar. And as far as alcohol use, we do see that they are lower compared to the other occupational groups in the state of Florida as well. The other thing we see here now is the prevalence of behavior among firefighters currently. And so we're looking at smoking status. And so firefighters are amongst the very lowest as far as current smokers, and as well as never smoking. So you can see that our firefighters, 74% have reported never smoking, only 1.8% at current smokers, and 24% at a former smoker. We're compared to blue collar workers, where they're at 27% currently, white collar at 13%, and other service workers at 20% currently smoking. And now we're going to be looking at our body mass index. So compared to the other workers, we do see a higher rate of individuals or firefighters who are in the overweight or obese category. So we see 51% of our firefighters, based on their BMI, were considered overweight and 31% considered obese. Both higher compared to our farmers, service, blue collar, and our white collar groups. And so what can we add to our fire departments as far as using a total worker health approach, specifically to obesity factors? So again, we look at diet and nutrition. What are your food options, your food availability, and your food consumption time? So we want to make sure you're eating healthy small meals throughout the day, that you're not loading up on high fatty foods, especially late at night. And then also exercise. What is the availability of exercise equipment within your department? The efficacy of working out. How easy is it for you all to schedule a workout during a shift period, and how you're able to do that as a group? And then what are your workplace policies for working out during the workday? The other thing we looked at in our chart book is health insurance coverage by age, race, and gender among our Florida firefighters. So we see that 99.5% of our firefighters have some type of health insurance. And then comparing that to the other occupational groups, we know that it's much higher. You see here our white collar, our blue collar, our service, and our farm and fishing, as well as our firefighters. When we talk about overall health status, we see that 63% of our firefighters rated their overall health status as very good and 35% excellent, which is higher than the other services. For health insurance, you see that they're at a 99% rate of having insurance compared to other industries where we're looking more at a 66 to 67% for their occupation. And the other thing that we saw in firefighters that's very favorable is having a primary physician. So we see that 88% of the firefighters reported having a primary care physician, where we see that the other services were more likely in the high 60s, 70s range of having a healthcare professional. And then as far as the last checkup, we also saw that 93% of the firefighters that participated in this survey, 93 of them have seen a healthcare provider in the last year, where we're seeing that in other services, there's more about 26 to 20%, even 41% in our farm and fishing that haven't seen a primary care physician in over 2 years. So a summary of the major findings that we found within this chart review is the higher prevalence of skin cancer than other occupational groups, higher among both the younger age groups and among the females. We also saw a lower prevalence of alcohol consumption and cigarette smoking, and a higher prevalence of overweight and obesity compared to other occupational groups. We also saw that there was a higher prevalence of physical activities than other occupational groups. And finally, Florida firefighters reported better access to health care in terms of having a primary care physician and having health insurance. And so now here we see the hierarchy of control. So this was published by NIOSH in 2015 as far as what do we do to eliminate hazards. So one, we have the elimination, substitution, engineering controls, administrative controls, and PPE. So what does that mean? It's most effective if we're able to eliminate or physically remove that hazard. It becomes less effective when we move to substitution or replacing that hazard. Engineering controls, meaning that we're isolating people from the perceived hazard. Administrative controls of changing the way people work. And then protecting yourself in PPE, which is the least effective within this hierarchy, protecting our workers with personal protection equipment. And so now we look at the hierarchy of controls, but apply to the firefighter total worker health program. And so again, we use the same structure of an upside down triangle: eliminate, substitute, redesign, educate, and encourage. So when we're looking at eliminate, we're trying to eliminate working conditions that threaten the safety, health, and well-being. Then we move to substitute. We want to substitute those health-enhancing policy, programs, and practices, or we can redesign the work environment for safety, health, and well-being. Also, we can educate for safety and health, which you guys are doing today. You're educating yourselves, and then encouraging personal change amongst your colleagues. So how do I get started with a total worker health in my fire department? So the initial steps to integrating total worker health within your fire department is starting a committee, and it can be something small. 2 to 3 firefighters from your department, and getting the support of leadership. And then you'd want to have a dedicated health and safety officer. The next thing you do is you're going to conduct a fire department needs assessment. You're able to do this by going on the CDC website and completing the worksite health scorecard. Then you're going to summarize your results from your scorecard. You're going to go over the overview of the results of the scorecard and then prioritize what areas can be feasibly worked on given the time and the resources that you have. So right here I can show you a little bit of what this scorecard is and the manual and the questions that they will ask. So you can see here the numbers next to each section. These are how many questions will be asked related to each health condition within your department. So they'll ask questions about tobacco use, blood pressure, cholesterol, sleep and fatigue, maternal health, cancer, stress management, and you answer based on your organization. So here are some example questions. Demonstrate organizational commitment and support of worksite health promotion at all levels of management. 2, include references to improving or maintaining employee health and safety in the business objectives, core values, or organizational mission statement. 3, does it promote and market health promotion programs to employees? And so once you're able to complete this for your organization, then you'll be able to assess where your needs are. Here's some other example questions related to organizational support. So does your organization provide access to self-administered sleep screening tool that provides a feedback report with recommendations for clinical action as needed? Or does your organization provide training for managers to improve their understanding of the safety and health risk associated with poor sleep and their skills for organizing work to reduce the risk of employee fatigue? Again, this is part of the template as far as your annual worksite health improvement plan. So you can see here there's intervention strategy, so what will you be doing? The process and evaluation measures, so how, when, and who will be doing that. And then communication, so the frequency, the methods, and the modalities you'll be using. And then what outcome evaluation measures are you going to have? So what metrics are you going to use to show that it's been successful? So in summary, we have that, total worker health are policies, programs, and practices that integrate the protection from work-related safety and health hazards with promotion of injury and illness prevention efforts to advance worker well-being. The other thing is how to establish a total worker committee within your department, building on existing occupational health and safety programs, fire department needs assessment and workplace scorecard that we just went over, and last, to enumerate and prioritize the opportunities for health promotion that can be integrated with health protection within your department. So thank you all for joining us today and learning more about total worker health. We really hope that you're able to integrate it within your department. And if you have any questions in any of the process for total worker health, always feel free to reach out to us at Sylvester and the Firefighter Cancer Initiative. Thank you.